Well, Dr. Michael Ison from Feinberg School of Medicine at Northwestern University joins me now to discuss the current flu season, as well as the latest information in flu prevention and treatment options. Thank you for joining me today.
Thanks for having me.
First, Doctor, tell us, how is the current flu season shaping up?
Yeah, well, as many of us are aware, last flu season was one of the worst flu seasons in recent recorded history. There were almost 1 million individuals with the flu that were hospitalized, and nearly 80,000 individuals that died with influenza. So last year was one for the record books. Thankfully, this year is appearing to be much less severe. The predominant virus is H1N1, which is typically less severe than H3N2, which was one of the predominant viruses last year. In addition, the flu vaccine seems to be a much better match to the circulating strains of flu, so more patients should be better protected against the flu shot. So hopefully a much less severe season than last year.
Hopefully so. Now, tell us, what is the best way to prepare for the flu season this year, and what can people do if they contract the flu?
Yeah, probably the most important thing people can do is get their flu shot. It's recommended currently for people that are older than 6 months of age. So really, pretty much everyone should get the flu shot. It's best to get it early in the year, around September or October, but it's not too late if you haven't gotten your flu shot already. We're right in the peak of flu season for most areas, and the season is expected to continue for another 3 to 4 months, and so now's the perfect time to get your flu shot. If, unfortunately, whether you get the flu shot or not, you get sick, it's important that you take care of yourself and protect others from getting sick from you. Best way to do that is by staying home from work, or if it's your child that's sick, keep them home as well. Being careful when you cough or sneeze so as you don't spread your germs, and washing your hands on a regular basis so that you don't spread germs. If you do feel like you've got the flu or get very sick, you should call your doctor right away. Most of the approved flu therapies are most effective if started within the first 2 days after symptom onset. So the earlier you call, the more likely you're to get therapy and the best benefit you are from that therapy.
That's good advice there. Now, you mentioned things that you can do once you get the flu. Tell us, are there any new flu treatments available this year?
Yeah, there is a new flu drug called Xofluza or baloxavir, and I'm honored to be working with Genentech that helped to develop that drug. The medication is something that has a different way of working than some of our older drugs like Tamiflu. In addition to having a new mechanism of action, it's a pretty easy medication to take. You take 1 dose and you're done. So once you take that 1 dose, you're effectively treated for the flu. It gives you excellent improvement with about a 1 day on average improvement compared to no treatment alone for symptoms due to influenza. So really a very novel action and a easy to take medication.
Absolutely. And tell us, why are these medications important for treatment of the flu?
Yeah, antiviral medications for flu are really important because, as we talked about, patients can get very sick, maybe even hospitalized or die from the flu, and these therapies are really being used hoping to reduce those complications. More importantly, they've been clearly shown to reduce the duration of symptoms by about a day, and I think anyone would want to feel better much more quickly. As patients feel better, they're more likely to be able to go back to work and resume normal function much more quickly as well.
Absolutely. Now tell us, where can people get more information about the new treatment that you just discussed that's available now, as well as more tips and information on fighting the flu this season?
Yeah, people can learn more about Xofluza or flu by going to Xofluza.com, Xofluza.com.
Great. Thank you so much. And again, for more information on everything we discussed today, you can go to Xofluza.com. We'll have that information provided for you again at the end of this podcast. Thank you so much for joining me today, Doctor. It's been a pleasure.
Thank you. Thanks for having me.
Have a wonderful day.
Thanks. You too.